Welcome everybody, my name is Remy Sovereign, and today I have a special presentation that I want to share with everyone today, and it's about how to heal a low back bulging or herniated disc, and it's a 6-step approach that I'm going to be sharing with you today. But before I get into sharing this presentation with you, I just want to kind of give you some quick facts and quick notes about myself and just kind of what I'm about. So a little quick about me. So I'm someone who has previously suffered from a low back disc bulge injury before that basically prevented me from working out at high intensities and also being able to play hockey for almost about 2 years. So I kind of know what this injury is all about. I know how it affects individuals from a psychological and physical perspective. Also, I'm a former competitive hockey player. So after suffering my injury, I wasn't able to play hockey for about 2 years, but I've recently got back into playing hockey, but not so much at a competitive stance anymore, as I've kind of got into different career paths in terms of coaching and whatnot. So also I'm a student, so I'm always constantly learning about new subjects, new things, whether that's in school or outside of school, always actively learning, trying to learn new things, whether that's about performance, injury prevention, or maybe just things related to disc injuries itself. I'm also a consultant advisor, so I work with people that currently suffer from low back disc injuries. Typically might advise on certain cases in terms of rehab, setting up a rehab program and kind of advising with people, and also working with athletes or other individuals kind of looking to work around an injury or looking just to improve their performance. I'm also currently a researcher, and I'm currently looking at high intensity interval training, a certain protocol that I'm currently looking at and studying right now. And lastly, and first and foremost, I am a coach. So I coach with people. So I coach people, whether that's athletes or individuals. I've spent time working with professional athletes, whether that's in the NHL or in the NBA. And I currently do work with people just looking to improve performance, whether that's looking to enhance a skill or just overall if their goals are to improve their lifestyle and health. So now, why should you listen to me? Well, first and foremost, I'm someone that has suffered from the disc bulge injury, and I know what the feelings of suffering from a disc injury are like, specifically in the low back that are causing sciatica. So when I suffered my disc injury, one of the most kind of significant things that impacted my life from a negative point of view in terms of not being able to play hockey, not being able to work out like I once did. So I know what a lot of people are going through when they suffer this injury, not only from a physical perspective, like from understanding the pain and a lot of the issues and limitations associated with the injury, but also just the psychological factors as well, whether that's feelings of depression, not being able to do what you want, or not being able to go out and enjoy your social life, whatever it may be, just because from the significant pain that this injury can cause. So I can relate to a lot of people that are currently going through this issue. Secondly is you've got a disc injury and possibly a lot of structural issues as well. So there could be, in addition to a disc injury, you may have a lot of structural problems as well, and a lot of other injuries that may be associated or related that have contributed to your disc injury. So understanding certain mechanics, certain postural issues that may need addressing as well. And thirdly, I've worked with professional athletes in the NBA and NHL who have dealt with disc injuries, as well as consulted and coached people with this exact injury. So for example, and for instance, training professional athletes, I've had the experience with professional athletes who have had disc injuries, low back disc injuries. So in terms of being in charge or helping out in terms of advising on their programming, their exercise programs, knowing and understanding the mechanisms that are revolved around how these disc injuries are created. So understanding the importance of prescribing the appropriate exercises that will prevent these injuries from occurring, and making sure that and educating these individuals that make millions of dollars on certain positions that they shouldn't be doing, or certain exercises that they should be avoiding in terms of preventing any further issues or problems from occurring. And then lastly, after making a recovery myself, I've been able to get back to the gym and playing hockey again, so doing a lot of the things I love. So after going through this injury, knowing everything that is kind of associated with it, especially from a psychological point of view and also from a physical point of view, understanding the pain and the feelings. I was able to kind of get back to working out at high intensities within the gym and also playing hockey again at a semi-competitive level. So now that leads me to my goals for this presentation for you. So my goals are, firstly, is just to educate you about the strategies that you need to make a recovery. So understanding things from an exercise point of view, a physiological point of view, and also a psychological point of view, kind of tying everything together in terms of creating a strategy that you could use to make a recovery from a bulging or herniated disc. And another goal of mine is to tell you what most people won't tell you. So this can be, a lot of doctors, physical therapists, maybe chiropractors might not tell you everything that you need to know about disc injuries. And my kind of goal is to kind of introduce you to a lot of things that they most likely won't tell you. So you have an understanding, you have an education about how these injuries occur, how they cause pain, and how to ultimately make a recovery from them. So on today's agenda, we'll begin by talking about what is a bulging and herniated disc. Then we'll talk about how does a bulging and herniated disc occur. We'll talk about how does it cause pain, how does it heal. We'll talk about a 6-step approach that I'll be going into, and we'll be talking about establishing a proper mindset, removing the pain-inducing activities, identifying the positions that are pain-free and of comfort. We'll talk about the importance of sleep, nutrition, and also exercise prescription. So to begin, what is a bulging and herniated disc? So here I have a picture or a diagram that I think clearly represents this from a good visual point of view, and I'm going to explain this now. So as you can see, we have a normal disc to begin with, and I'm going to go through each one by one here. So we have a normal disc to begin with, so this is what a normal disc would look like. And we have our annulus, which is basically the outer layer. Then we have the outer zone of the annulus, inner zone of the annulus, and the nucleus. So the annulus and nucleus is basically the layers that kind of make up the disc itself. And so we have a healthy disc or normal disc here on the far left. So moving into a disc bulge now, which can also be classified or known as a nuclear herniation. And all a nuclear herniation is kind of referring to is we see there's disruptions within the nucleus now, which is the center of the disc material, and it's causing the annulus to basically bulge outwards, and it can bulge out in any direction, as you can see by the red illustration of the circle. So that red circle there is representing a normal, healthy disc of what it should look like, and then anything on the outside of that red line there is what's representing the bulge, so where it's bulging. And so you have the border of the normal disc, just like I mentioned. And then we have disruptions kind of within the annulus and then the nucleus there. Moving on to a disc protrusion. So a disc protrusion can also be commonly referred to as maybe a disc bulge or disc herniation as well, more specifically in the case of a disc herniation. But many people may still refer to it as a disc bulge and a disc herniation. So what I find is they're very interchangeable terms, but when talking about a disc protrusion, what we have is a contained herniation. So what we see with the disc protrusion is the nucleus now has begun to herniate in the posterior lateral aspect of the disc. So if you look at the disc here, the nucleus now has herniated to the posterior lateral aspect of the left side of the disc. And that is causing, or what is known in clinical terms as protrusion. And then if we move on, we have a disc extrusion, which is now, all that has happened now is the annulus has teared and the nucleus, the herniated material from the nucleus now has basically bulged out of the center and herniated out through the annulus where it's torn. So now we have a non-contained herniation, for no better terms. So still practically a disc herniation, it's just it's not contained within the disc now, whereas in a protrusion we have a nucleus being herniated, but it's still contained within the disc. And then we have a sequestered disc on the far right here, which is basically all that has happened now is we have a portion of the nucleus or a fragment that has split off, or a fragment has split off and has been released into a localized area outside of the disc, which could potentially cause significant problems. So guys, these are just kind of different clinical terms to understand what a bulging and herniated disc is. Oftentimes, bulging and herniated discs are used interchangeably. As you can see, you pretty much have a progression of damage to the disc occurring. But the key thing here, guys, is that one may have a bulging or herniated disc and they may not have any pain. So someone could have a disc extrusion and have no pain, where someone could have a disc protrusion and have significant pain. It all depends on the location of where maybe the bulge is occurring or the herniation is occurring. So disc protrusion, extrusion, and a sequestered disc commonly are known, all can be classified under the term as a herniation, but a bulge can also be classified for them as well, which you may see a physical therapist or chiropractor may refer to a more common terms as a disc bulge or disc herniation. But just to kind of show you the more clinical definitions here of how these disc injuries and how they're classified in terms of the damage associated with them. So now, what is a spinal disc made up of? So we have water. So we typically have a higher content in the nucleus when compared to the annulus. We have proteoglycans, which it's found that there's a higher content in the nucleus when compared to the annulus, similar to water. We have type 1 collagen, which we have a higher content on the outer layer of the annulus, which kind of provides that tough ring-like structure on the outside of the annulus. And when you consider the nucleus, it's more of a gel-like substance, where the annulus part is more of a very tough substance. And then we have type 2 collagen, which we have a higher content found in the nucleus, but there's many forms of collagen found in the disc. It's just type 1 and type 2 are typically the most abundant, 80% roughly, but we also have type 3 collagen, type 4 collagen, and many other collagens that are found in the spinal disc. So keep in mind, guys, proteoglycans and collagen are proteins. So just keep that in mind, because I'm going to be talking about this in more detail later as I move throughout this presentation. But there are many other molecules that also are made up and found inside the disc, whether that's ATP, lactate, oxygen, or glucose. There's many molecules in there that are important in maintaining the health of our cells and the maintenance of our discs. So any disruptions in these molecules or loss of these molecules could cause significant damage to the disc, whether that's degeneration or potentially maybe a herniation. So for instance, if we're not producing ATP within the disc through glycolysis, then the disc cells will die, because ATP being our universal energy source, it's important in the formation of proteoglycans, important in ion signaling and molecule signaling and transportation. So if we can't produce ATP, whether that's through an absence of glucose or oxygen, then our disc cells will die over time, and very rapidly as well. So how does a bulging or herniated disc occur now? So repeated movements of spine flexion, spine lateral flexion, or spine flexion with twisting, with and without load, are what is going to cause this mechanism or to create these bulging or herniations to occur. So now I've kind of underlined load here, because as we increase the load on our spine and we start doing these movements, we're increasing a lot of the stress placed onto our disc, which can kind of significantly speed up the process of at the rate at which a bulge or herniation will occur. So some examples: poor deadlift technique, tying shoes, or shoveling snow with poor posture. You could also have the effects of whiplash, like from a car accident or a sports injury from maybe getting hit into the boards, or just having your neck snap back. You could have a herniation occur in your neck, or whatever the case may be. So here we just kind of have a diagram of an individual shoveling snow. So as you can see, we have flexion. You could have lateral flexion. You have forward flexion, lateral flexion, and twisting occur. And then as the individual shoveling snow and putting snow onto the shovel there, now they're increasing the load on their spine. And this is how people tend to sometimes throw their backs out. Now, keep in mind, it's not one instance that's going to occur. It's going to usually be an accumulation of activities and movements like this over time and as we age that are going to cause this herniation or bulge to occur. You could also see this machine that I have here, which is just kind of like an ab crunch machine. Now with load, this is Now, while this may be a great exercise for developing abs, not necessarily a great exercise if you're looking to damage the posterior annulus of your discs, especially in the low back. So someone with disc bulge or disc herniation would want to avoid this pretty much at all times. And poor deadlift technique is another example, which is poor deadlift technique is where a lot of people tend to usually create a bulge or herniation. Typically a bulge or herniation may be already created, but a poor deadlift technique, especially with heavy weight, could be that instance where now you cause the pain to occur or the flare up or whatever the case may be. So now, moving a little bit forward, how does this bulge and herniation occur? So if we just look at the movement, so here we have a disc extrusion. So we have a posterior lateral disc extrusion, which is a non-contained herniated disc. And if we look to a hockey player here, a right-handed hockey player that is shooting a puck, this is a mechanism that will create this posterior lateral left side disc extrusion to occur. Because if we look at a hockey shot, a right-handed hockey shot, they're getting twisting, they're getting forward flexion, and they're also getting lateral flexion occurring, which over time, if we do potentially thousands of cycles of this, it could create a herniation or bulge to occur. Now, if you combine hockey shooting with maybe poor deadlift technique, poor sitting posture, poor lifting posture when tying shoes or tying skates, all these activities over time will significantly speed up that process at which that bulge or herniation will occur. And for hockey players, it's, a disc herniation or disc bulge is a relatively common injury. You see a lot of high-profile NHL players have suffered through this injury. You could look to guys like Jason Spezza, Ilya Kovalchuk, Zach Parise, Daniel Alfredson, all high-profile players that have suffered from a herniated disc and either had to go through conservative treatment or had surgery done to repair their disc herniations or disc bulges. So now, how does a bulging or herniated disc cause pain? So now getting into a little bit of the physiology of how pain is created as a result of a bulge or herniation. So we have nerve root compression. So this is in the case where, material from the disc may compress the nerve root, whether it's a sequestered fragment or there's a herniation, non-contained herniation, or we just may have the bulge from the disc pushing outwards and causing compression on the nerve root, which would result in an inflammatory response and can cause irritation to the nerve, which will also elicit an inflammatory response. And this could result in pain as the disc is constantly compressed on the nerve root. We can also have direct damage to the disc itself. So inflammatory markers such as tumor necrosis factors, various interleukins. So they're found to be associated and increased upon damage to the disc, whether that's in degenerative disc disease or in a disc herniation. So upon accumulation of these inflammatory markers, they may interact with various pain receptors that are located around the disc, and this could cause or trigger a pain response or pain-induced response. And we can also have the accumulation of acid metabolites, whether that's lactate, lactic acid, which will decrease the pH, and it'll affect the cellular environment. So by decreasing the pH with regards to lactic acid, what that could do is going to alter the cellular environment. A lot of enzymes, proteins may now denature and not work as they're supposed to. Cells will die within the disc. And another thing that could occur is that as these metabolites leak out of the disc, that they're going to cause a decrease. So we have that decrease in pH, but it could have an effect on the nerve roots, and it can cause an irritation to the nerve roots because of its acidic properties, which could result in a significant flare-up in pain for an individual. So what we see here in this diagram now is that, so this yellow kind of line here is representing the nerve roots. And what we see now, these little red dots are the accumulation of inflammatory markers or acid metabolites, whether that's lactate, lactic acid, or interleukins, inflammatory markers, whatever the case may be. And upon increasing the damage to the disc, we're going to have more of we may have more accumulation of these markers or metabolites, which could result in significant pain that one may experience. And that's going to depend on also if we have compression on the nerve root. So compression on the nerve root is going to elicit more of an inflammatory response as well, and can cause more pain for an individual. So as we see, guys, going through the physiology here is important to understand, because we have to understand what's going on to the disc in order to properly treat it with various conservative approaches, or whether that's through nutrition or whatever it may be, to kind of cause the disc to begin the process of healing itself, which leads me into my next slide. How does a bulging or herniated disc heal? So number one, it's believed through a natural resorption process. So if we have disc material such as a fragmentation from a sequestered disc, it may get reabsorbed by the body or the disc itself. So our tissues or our body may reabsorb the material. So we may have various markers. So upon a disc herniation or sequestered fragment, our body will elicit an immune response, which may begin to break down that herniated area or that fragmented portion of the disc, and then cause that material to be reabsorbed in the body. We could also have the addition of new blood vessels. So there may be new blood vessels that are created in response to a herniation or a sequestered disc to allow for more nutrients to get to the region to help in the repair process, but also to get rid of a lot of the debris that is accumulated. Specifically, that could be lactic acid or lactate production. So what we can see here, guys, is what we have is, if we look at the blue lines, if you look at the bottom of this diagram here, and if you look at the blue lines that are pointing to the cartilage. So the end plate cartilage is important in disc nutrition. So what we see, and then if we see at the kind of the outside layers of the annulus, we have red squiggly lines, and those are just blood vessels that are going to the disc. So we have small blood vessels that are going to the outside of the disc, and those blood vessels are responsible for providing nutrition to the outer layer of the annulus. However, with regards to the nucleus and the inner 2/3 or so of the annulus, and then so we have the nucleus and the inner 2/3 of the annulus, disc nutrition is primarily supplied via diffusion across the end planes. So we have these vertebral end plates, or these the hyaline cartilage end plate, where various markers, or as we see these green dots here, which are representing good molecules, whether that's ATP or glucose, that are going into the disc, that are being transported into the disc, and that's occurring via these red blood vessels that we see in the vertebral bodies. So those red blood vessels that are in the vertebral bodies, which we see at the very bottom of the diagram here. So the disc, inner disc, and the nucleus and the inner 2/3 are primarily getting their nutrition via the blood vessels that are going into the vertebral bodies, and then upon diffusion across the end plates, these molecules will then enter into the disc and supply the required ATP or glucose or whatever molecules that the disc may require for nutrition. So basically the end plate is acting as a membrane. We have diffusion occurring across the membrane in order to get our molecules into the disc and supply it with the nutrition that it needs. Now, if there's damage to that end plate now, which acts as a membrane, we may get closing of various pores or cavities, which if we get closing of these pores or cavities, then we could have a decrease in diffusion and a decrease in tissue, or a decrease in disc metabolism, which can then begin to lead to the degenerative process of a spinal disc. So as we see, nutrition is a very important factor here when just looking at this diagram. So as we see, these green dots are representing good molecules where we have nutrition kind of getting into the disc, whether that's ATP or glucose, to stimulate anaerobic glycolysis, to start producing ATP, which the disc needs to survive, because ATP is important in producing proteoglycans, also important in cell signaling and transporting molecules throughout the disc. But as we move through each stage of the disc, moving to a disc bulge, we may have less molecules entering into the disc, and that could be a result of damage to the end plate, and this will carry on throughout the process as we move through protrusion, extrusion, or sequestered disc, which could be occurring. Now this is going to depend on the damage to the end plate though, and if we look at a sequestered disc or a herniated disc in a disc extrusion, we also can get the formation of new blood vessels to the herniated area to help supply those nutrients, like I mentioned before, how we can get these addition of new blood vessels to help kind of pump more nutrition into the disc to help repair it, and also to remove a lot of the debris that may have accumulated. And so we have those green dots just representing the nutrition, more nutrition kind of going into the disc. So moving into the 6-step approach now that I'm going to share with you in terms of how the recovery process will work for an individual, and kind of my thoughts on what I believe is kind of one of the best approaches in terms of a conservative effort for treating this injury. So the 6-step approach will be different for everyone, but the general concepts will be relatively the same. So everyone has everyone's injury is going to be specifically different. So someone may have a sequestered disc, someone may have a protrusion, depending on what side it is on the body, left, right, is it posterior, is it posterior lateral, the severity of it, how big is it, what level is it at, L4, L5, L5S1. It's going to be different for everyone, which can alter a lot of these steps, and which will make them different for everybody, but the general concepts will be the same. So concepts 1 to 4 are the most important, and an individual can receive results if these are addressed adequately. However, concepts 5 to 6 are very important as well, and if steps 1 to 4 aren't addressed, then steps 5 to 6 won't be very effective in helping an individual recover from this injury. And I'll explain why as I go through each step. So the first step, establishing the right mindset. So understanding what your motivation level is to get better. So typically a lot of people that are suffering from this injury already have the motivation to get better because they're seeking help. So they want to get better. No one wants to be in pain all the time. So motivation isn't necessarily an issue in the beginning, but it can be an issue as the process goes along. And I can share with you just my personal experience that, there was times where I lost motivation because, either the process was very long and maybe I wasn't patient, or I just wasn't getting results with a lot of the stuff that I was doing, and I didn't necessarily maybe believe in the recovery process. And this led to maybe feelings of depression, feelings of failure as well. So addressing those issues or problems would be important, and it's important to kind of get that right mindset and the right mentality to begin to make the recovery from this injury. So you need to have the motivation, desire to get better. So now if you're only doing things 50%, or you're only following certain things, then you're not going to get the full outcome of this approach. You're only going to kind of do things at a half rate, which may only result in maybe half the results, but it's ultimately going to disrupt the whole recovery process here, and you're not going to and it may delay the recovery, and you may not kind of get the most out of it. So it's important to kind of, when approaching this injury, you need to have the motivation to get better, and which a lot of people will already have, but the key thing is just constantly kind of maintaining that motivation. So if you're someone that is struggling with motivation, looking at other individuals, looking at other cases, looking at other people suffering from this injury and connecting with them, and just looking at their story to see if they have overcome the disc injury or if they're just going through the same thing as you. So, a lot of people, with regards to my YouTube channel, like for a lot of people that kind of reach out to me, I'm always trying to connect with individuals, and I try to offer advice where I can as best as possible, because I know how hard this injury is to occur, and there's not a lot of information about this injury and how to overcome it. And so a lot of people are kind of maybe stuck at certain stages, and they start getting depressed. So just doing my best to try to motivate others. I do my best to try to help others, but also the key thing is just trying to reach out to those type of people who may be going through the same thing as you, to maybe look for inspiration or whatever it may be. So I like this kind of little picture here. Every accomplishment starts with a decision to try. So, if you're not trying to get better, then, you're not going to accomplish your goal of overcoming this injury, if that is your goal, and which I believe it is, since if you are watching this video. And then I have another picture here, which is life is always better when we are together. So, keep in mind, guys, you're not alone. If you're someone, so I'm assuming that if you're watching this video, you do have a disc injury. And the key thing is, guys, you're not alone. I'm right there with you guys. I suffered through this injury, and it took me a long time to overcome it, but I had to be patient with the process. I stayed motivated. I kind of maintained a stubborn mindset where I wasn't going to let this injury hold me back, and I was going to make that return to hockey. I was going to make that return to weightlifting, heavy weights again in the gym. That was kind of my goals. I wanted to get back to that, and I used that as motivation of where I wanted to be, and I set those goals as I went through the recovery process, and just kind of always referred to those things whenever I lost hope or had feelings of failure. So establishing the right mindset is key before you begin the recovery approach. You need to establish that proper mindset. So that moves me on to step 2 now. Now you need to identify and remove the pain-inducing activities or triggers. So does sitting cause pain? Does bending over cause pain? If so, which way, which direction? To the left, to the right? Do you have pain going down both legs, or just one? Or is it just localized to the back? So it's important to identify these triggers, because if you don't identify them and you consistently engage in these pain-inducing activities or triggers and you don't remove them, then you're not going to allow that recovery process to occur. Like I mentioned before, going through the physiology, you're going to cause more inflammation, maybe more pain and more damage to the disc, which is only delay the process. So if you don't identify and remove the pain activities or triggers, and you keep kind of working through it, you're only going to cause more damage, more issues, and this is just going to delay the recovery process. You're not going to give yourself or your body a chance to heal, which is very important, because if you constantly keep doing movements or activities that are pain-inducing, causing more damage, you may cause more damage to the disc, and next thing you know, you become a surgical case, and you don't want that to happen. So identifying and removing the pain-inducing activity or trigger is, I can't stress how important is this, because if you don't remove them, then you're not giving your body the chance to heal and recover. Which leads me to step 3 now, identifying the pain-free positions and assume these positions as best as possible. So this kind of ties in with step 2. So understanding what positions feel best. Does laying down feel good? Does standing feel fine? So here's just kind of a picture of me where I was, when I had my discogenic pain, I'd constantly lie on the floor with kind of a couple pillows under my hips. I'd work on a computer like that. This was one of the most comfortable positions for me. This time, in this position, I was pain-free, giving my body a chance to heal. And so you have to assume those positions as best as possible. So also looking to, does walking feel good? Hanging upside down. So maybe engaging in those activities as well would be beneficial. So obviously, why assume pain-free positions? Simple. So you're allowing for the healing to occur, so without causing any further damage or delaying the recovery process. So being in those positions as best as possible will allow for less damage to occur to the disc and allow for healing to occur. So moving on to step 4, we'll talk about the importance of sleep here. So sleep is very critical, because if you're not sleeping, then you're not going to be able to recover, and it's going to affect you in many ways, which I'm going to talk about here in a sec. So sleep, why is it important? Well, sleep allows us to recover, and a lack of sleep will disrupt our circadian rhythm, which will impact our body's physiology, specifically our inflammatory response, and potentially delay our ability to recover. So when we consider the circadian rhythm, a lot of our hormones, molecules, and genes operate on a 24-hour biological clock. And so there's different expressions of them at different times of the day. And specifically, just to give an example, cortisol being one of them, being a hormone that is expressed with a significant increase in the morning, and then it kind of fluctuates throughout the day. And then we have a big significant drop at night. So if we aren't sleeping properly, aren't following a proper, circadian rhythm, we're going to have disruptions within a lot of molecules, whether those are anti-inflammatory molecules or various genes that promote anti-inflammation or promote healing. We could have disruptions in them. because we're not sleeping, not allow our body to recover, and this could potentially create a lot of issues. So a lack of sleep not only will impact us physiologically, but also psychologically as well. If you're not sleeping, you're always tired, or this could lead to moodiness or depression, lack of motivation if you constantly aren't sleeping. So you have to understand, do you get a good night's sleep, or do you have trouble sleeping? So if you have a good night's sleep, then that's good, that's positive. If you have trouble sleeping, then you're gonna have to look to address that with finding the right sleeping positions, or maybe looking to maybe if you need to take pain medication or something, or anti-inflammatory medication to help you sleep because you're in significant pain, which is something that I did, because when I had significant muscle spasms, I could not sleep without taking anti-inflammatory medication, because I'd wake up in the middle of the night with significant pain, and then I'd have to take a painkiller just to get back to sleep. So these are kind of just two images. Are you sleeping good, sleeping like a baby, or are you sleeping at work? So those are kind of just indicators of if you may be getting a good sleep or not, or you may be following a good sleep schedule. So addressing sleep is important. So because just to kind of recap, if we don't address sleep, it's going to impact our physiology, and it also affects us psychologically as well, because if we go back to establishing the right mindset, if we get depression, lack of motivation, this will basically disrupt our feelings, and we may not start believing in the recovery process or whatever it may be, and we may just give up and lose all hope, which is we don't want. We want to avoid it at all times and all costs. So before I move into step 5 here, just want to say steps 1 to 4 are the most important and need to be addressed first in order to before we move to steps 5 and 6, because if steps 1 to 4 aren't addressed adequately, then steps 5 and 6 here won't be really essential, or won't be they may only be very minimally helpful in the recovery process. So step 5, addressing nutritional deficiencies. So we got to look to boosting our nutrition now. So are you protein deficient? Well, if you're protein deficient, you're not going to be able to maybe make proteoglycans or collagen, which we look at the annulus when it's made up of type 1 or it's made up of we have type 1 collagen on the outer annulus, and when we have tears on the annulus there, we had to reestablish that collagen maybe, and if we're not able to build collagen, that could be a result of having a protein deficiency. Mineral deficiency, which is important in glycolysis. If we're deficient in minerals and also vitamins as well, we're not able to generate ATP through glycolysis, which we know ATP, universal energy source. It's important in maintaining cell life within the discs, and if we don't have that, our cells will die. Water. So water is important in kind of maintaining the that hydraulic kind of system of our disc. So if we're deficient in water, we may lose certain chemical and mechanical properties of our disc to maintain load, and we can cause damage to the discs. Smoker, anemia, so smoking and anemia, this could cause issues with regards to red blood cell production. If we're not producing as much red blood cells, we're not able to maybe get as much blood to the area to begin with, to the disc area. We're not able to transport nutrients there, so therefore we have a decreased tissue, or we have a decreased diffusion of nutrients, maybe across the end plates, or just a reduced metabolism occurring, which can cause a lot of issues with the disc in terms of cell death, or whatever the case may be. So if deficient, especially in a state of injury, this may significantly kind of delay or impact our recovery. Just like how I kind of mentioned, if you're protein deficient, not able to make collagen or proteoglycans, or mineral vitamin deficiencies, you're not able to kind of establish glycolysis efficiently and produce ATP. Especially when we talk about state of recovery, because our body's already using more energy to help in the recovery process. So we're going to need to up our nutritional intake to kind of address a lot of the issues going around associated with the disc. It's also important to keep in mind is that in addition to the disc, you may have other issues associated, whether that's maybe damage to the end plates, or other kind of low back issues, or just other injuries in general that are going to also require energy through forms of ATP, glucose, and oxygen to kind of help in the repair process. So just some kind of some tips. So Looking to an expert nutritionist, a naturopathic doctor, a registered dietitian, maybe of consideration. So it's important because I'm not just recommending anyone here. It's important that if you address this step, looking to someone that's an expert on this topic in relation to a disc injury. Now, I'm going to kind of emphasize that in relation to a disc injury, someone that understands the physiology of how a disc injury occurs, the responses that are associated with it, and the proper minerals, vitamins, or nutrients that an individual will need to make a recovery with regards to a disc injury. So getting someone that is an expert in disc nutrition, whether that be an expert nutritionist, naturopath doctor, registered dietitian. So those are some people of consideration to look out for. Moving on to step 6 now is exercise prescription, which I believe is, in terms of kind of order of importance, I think this is kind of the last step that I believe needs to be addressed, and I'll explain why. Now, not that it's, keep in mind though, exercise is very important. I believe it's one of the more bottom phases of steps that needs to be addressed in terms of importance. So why do we need exercise? So to address any weaknesses, whether that's postural deficiencies, motor patterns, instability, building strength, endurance, improving spine tolerance and capacity, preventing future injuries from occurring. And so with regards to why I believe exercise is kind of importance in terms of kind of the last step here, and why I've included it as the last step, is because the thing is if we are in constant pain and exercise causes us pain, then how are we going to do exercise if we're always in pain? We need to kind of get out of those. We need to address the issue. We need to allow our body to kind of already make that physiological recovery, whether that's through nutrition, whether that's in combination with nutrition and combining, removing those pain-inducing activities, getting a good sleep, and also getting into those pain-free positions to allow our body to start allowing for the disc to heal through a physiological process. And then once we allow that and the pain comes down, we can now engage in exercise, which a lot of people aren't necessarily able to do when they suffer from this injury, because they're in a lot of pain and they can't do a lot of the exercises, because a lot of the exercises that physical therapists or chiropractors are recommending to them are causing more pain, whether that's through maybe even doing a plank or something. Because when we hold a plank, for instance, a side plank or a plank, we're causing our muscles to contract, our abdominal muscles, which is creating a stiffness within the spine, which could create irritation onto a nerve root because we're causing more compression on the nerve root. We get more of an inflammatory response, more pain would occur as a result. So when we're talking about exercise, do they need a core training program, a walking program, maybe a mobility program? They have mobility within the hips, maybe stretching they need, inversion therapy, another consideration. Posture, do they have rounded shoulders, forward head posture? This could place more compression onto a disc. Motor patterns, how do they walk, how do they move? So, you see individuals, they may be lacking in the swing phase of one of their arms when walking, or they always walk with a hand in their pocket, which could lead to very improper motor patterns. Maybe could lead to something like scoliosis or other issues, or other spinal issues that may be related as these improper motor patterns are constantly performed over time. So addressing those would be of importance too. So we see certain exercises with side lying hip abduction, see a McGill crunch on the far right, or a bird dog exercise would be of another consideration. These are kind of common exercises that are maybe prescribed to someone with regards to exercise. So the thing is, exercise should only be prescribed as it permits for an individual. So if side plank or a plank is causing pain, then they shouldn't do it, and this would be an indication that they need to regress and kind of go back to those previous steps, address those more adequately, and then wait till the pain comes down, and then kind of start progressing and building up to exercises that are going to build up that capacity, that tolerance, that strength, endurance, and prevent future injuries from occurring. So of consideration here, so an expert strength or performance coach, expert, physical therapist, chiropractor, someone that knows how to not only prescribe exercise, but also teach and coach exercise as well. So myself being a coach, performance coach, this is kind of my expertise here. This is where I'm most familiar with. This is kind of my strong suit here. And in addition to physiology as well. So just understanding how exercises should be performed properly and how they should be coached in terms of coaching cues and whatnot. So the key thing here, though, is finding an expert with regards to this, but only but key thing is so making sure these individuals are familiar with disc injuries and they know how to treat disc injuries, and they have, treated or worked with people that may have suffered from disc injuries. And so that is the key thing there. The thing I want to emphasize is an expert, maybe coach or PT or chiro, that is familiar with disc injuries themselves. Because, a lot of people tend to go to chiropractors, physical therapists, and they get very limited results because where the PT chiro doesn't fully understand the injury, they're not maybe they're prescribing ill-advised exercises, maybe making things worse for the patients. Then the patients get frustrated, it affects their psychology. Then they start losing motivation. Pain gets worse. They're paying all this money. They start having these feelings of failure and okay, I'm paying all this money. And the next thing things keep getting worse. Now they're considering surgery. Now they want to get surgery done. They're getting injections done. All these things. All these things are starting to happen. That's very unnecessary. And it's kind of very sad to see this happening because it shouldn't. And it's kind of showing that there's a failure or a sense within parts of the system of how people are being treated. So that's why I recommend kind of working only with someone that is very familiar with disc injuries themselves. So now putting it all together, guys. If all steps are applied efficiently, then one will be setting themselves up for success and, most importantly, recovery. However, it's important to note that if any of the steps are skipped or not addressed efficiently, then this will significantly impact the success that one is going to make a recovery. So it could significantly impact the recovery process or delay things. That's why it's important to address all steps efficiently and adequately. Lastly, it's important to note that every case is going to be different. Now, there may be a lot of overlap between cases, but like I said, someone may have an extrusion or protrusion, bulge, herniation, whatever it may be. Could be at L4, L5, L5, S1. The degree of that damage is going to be different for everybody in terms of when looking at the millimeters or of how significant that bulge or herniation is, and is it impacting a nerve root? Is it hitting a nerve, or is it just causing localized pain? Whatever the case may be, everyone is going to be different, and everyone is going to progress at different paces. And so that's why it's kind of hard to compare one case to another, because everyone is different and everyone has different healing capacity as well. So when we think about genetics as well, some people heal faster than others. So that's just kind of the important kind of thing that I wanted to last mention, is that every case is going to be different and not one will be exactly identical. It's that everyone is going to be different in their own way and how they progress and kind of move through this process. So now, will this approach work for every case? No, it won't, since some more severe cases may require surgery. That may be in the case where people have lost all hope, that they just have lost all hope and they don't believe, they just don't believe conservative, therapy or whatever may not work for them, and they're only thinking that surgery is for them. Or in other cases where, you have started having neurological problems, maybe loss of bladder, loss of some sort of function of maybe certain body parts that aren't working properly within the lower body because of the result of that nerve irritation, or you may have nerve damage. Those are the more severe cases that may require surgery or immediate attention. So we could also look to stem cell therapy, IGF injections, inversion therapy, heat. These are all other methods that, that seem to, that could maybe work for some individuals. When we look at stem cell therapy, IGF injections, injecting, stem cells or insulin-like growth factors into the area could help stimulate repair of the disc. It can maybe provide some of those nutrients and building blocks that it needs for recovery. However, there still needs to be a lot more research done on the kind of these techniques, but they could be also applied to this kind of conservative approach. If they are kind of proven to, work efficiently for individuals. But we could also look at inversion therapy, which is something that, I recommend, but it's not for everyone. Some people find significant benefits from it. Other people may not. Also look to heat. So heat is something I truly recommend, just because if you apply heat to the area, you're increasing circulation, increasing blood flow to an already avascular area that has very limited blood supply, and primarily only gets its blood supply across those end plates through the through the blood vessels that go into the vertebral bodies, and also on the peripheral area where we get these smaller blood vessels supplying nutrition to the outside of the annulus. So if we increase heat, we're not only moving more nutrients to the area, but we're also removing nutrients as well, or bad nutrients that may have accumulated, whether that's lactate, lactic acid, which could have a significant impact on the pH and could cause a pain-inducing effect when maybe interacted with the nerve roots. And it kind of blows my mind sometimes when people recommend ice, because I don't know, it's, you know, when I see PT or chiro or some sort of doctor recommend ice for disc injury, I think it's one of the, I don't know, it's one of the worst things I could, you know, I see, just because ice is vasoconstricting, you're reducing blood flow to the area. Why would you want to reduce blood flow? You're only decreasing blood flow to the area, which is going to delay recovery. Why would you want to delay recovery? It doesn't make any sense to me. And it just blows my mind when I see things like that, which I've kind of talked about in a previous video before. So kind of moving on. So the 6-step approach, it kind of addresses disc injuries from a global perspective. So we're taking into consideration exercise, nutrition. We're considering the psychological factors as well. You know, motivation, establishing mindset. We're taking into consideration sleep. So addressing a lot of the physiology involved, which is what is responsible for, you know, for disc healing. And it's not, you know, a lot of people have this mindset that, oh, I got to do all these exercises. I got to do all these exercises in order to get better. And that's your, you know, your typical physical therapist approach, where they're using like a mechanical treatment to help with the treatment of a disc, but that's not really what's allowing for healing to occur. It's more so rest and improving your body's immune system and improving your body's physiology, which is allowing for recovery to occur. And you do that by removing activities that cause pain, and you do that by improving your nutrition and keeping yourself in those pain-free positions, as well as improving your sleep, are all going to impact your physiology, which will allow for a quicker recovery. Exercise is more important in, you know, preventing future injury, building up the tolerance that your tissues need to kind of sustain load for the future or whatever, in terms of preventing future injuries, future disc injuries from occurring, and kind of providing that support and stability the spine needs. So guys, I hope you enjoyed this presentation. And if you haven't yet, be sure to subscribe for more spinal disc recovery tips. And if you want to get back to deadlifting. Now, there's something I just remembered that I forgot to address early on. So for those, when I was talking about disc protrusion, disc extrusion, and sequestered disc, so with regards to my MRI, just for some clarification, my disc, while it was kind of claimed to be a disc bulge and said to be a disc bulge on my MRI, which shows to be a disc bulge, but the kind of clinical findings were referred to as a disc protrusion, which is a result of a contained nuclear herniation. So you still got it, it's still a disc bulge, but just kind of clarify that for anyone wondering. And so if you want to get back to deadlifting, guys, here's just a little video that I'll kind of finish off with, which is me kind of just returning back to lifting heavy weights again, which hopefully provides you with some inspiration if you're looking to get back to deadlifting. Okay, guys. Thanks, and hope you guys enjoyed.